To mask or not to mask? That is the question. Gloves, when used in that way, are cross-contaminating, spreading a virus everywhere. N95s, P95, R95, KN95, P100, lots of different letters and numbers. We're gonna go over all of that today, what those mean, and which masks that you should or should not be wearing. Hey everyone, I'm Dr. Wagner. I'm a board certified emergency medicine physician, and on my show I answer your urgent medical questions and clear up myths about deadly diseases. If you haven't already done so, please hit the subscribe button and turn your bell notifications on. That way you're notified when I post a new video. When the outbreak originally occurred, the CDC had mentioned that only people who are sick, who have medical conditions, who are immune compromised would likely benefit from wearing a mask. And it was also in combination with the fact that people were stockpiling and potentially hoarding all the N95 masks and surgical masks that were preventing healthcare workers from actually getting those, and they're on the front lines and need them imperatively to treat us all. Now that there is some improvement in the production of these products and personal protective equipment that healthcare workers are using, the CDC has come out and said that about 25% of the population is asymptomatic with this COVID-19 virus, and it could spread it to other people without even realizing it. Typically, you could potentially spread a virus for 2 to 3 day period of time before you show symptoms. So now there's a recommendation that potentially wearing a mask could help prevent giving the illness to other people when you don't even realize that you have it. There are multiple different types of masks out there, and we're gonna go over a bunch of them. There's the surgical mask, there's the do-it-yourself mask, and there are multiple different types of N95s, R95, P95, everything you could think of, not P90X like Tony Horton doing the workouts. There are masks that go on your face with different filtrations and different types of materials, such as oil or not. They all need to be approved by NIOSH and the FDA. Today, I'm gonna go over which mask is which and when you should wear it. All right, the cloth mask. This one's for anybody and everybody. If you're out walking your dog, going grocery shopping, you can wear this mask. Just realize this does not keep out all the germs and the bugs out there, but is our best, easiest first line defense. Surgical mask. We see nurses wear it, doctors wear it, it's used in the operating room, it's used for painters to protect their faces. We see it everywhere. Again, this is a good mask to use if you're out and about in your community, if you're grocery shopping, walking your dogs. They're stockpiled by somebody because they are still hard to find. So if you do find them, please first find out if you can donate it to the hospital. Otherwise, you can use it and protect it for yourself. Surgical masks do not keep everything out. They're typically made of 3 different pieces of fabric, sometimes 2, and they're not form-fitting, so air can get in and out on the sides. And it does have a piece on the nose that you need to compress down and smooth it down to your face. The N95. This is the quintessential mask that we use in medicine and in the healthcare setting to prevent particles and viruses from getting in and out. But these masks should only be used in a professional setting. The everyday person does not require this mask, as it is used for aerosolized procedures and preventing deadly diseases from people who are saving your lives on the front line. The N95 mask is specifically fitted for every single person. We go through testing where we wear a massive hood and they spray a specific material in there that we are not able to smell if the mask is fitting appropriately. If it is, it's not the right size. So please, save the N95 mask for healthcare workers because it's specific for what they need to do on a daily basis. I want you to think about it this way. If you are out there wearing the N95 mask and I'm in the emergency department seeing 20 patients with COVID-19 and I don't have a mask, I won't be able to help you who might end up in the emergency department because I could be really sick and at home quarantined and not doing the job that I need to do to help everybody. So, important for all of you guys to know, the N95 mask should be prioritized and given to the frontliners, your paramedics, your firefighters, your police officers, the primary care doctor, nurses, ERs, clinics, any place that's doing COVID-19 testing. They are all out there risking their lives to help prevent this disease from getting even bigger and to help our community and society beat this darn thing. So make sure that you leave these masks for those individuals. Now, if you wear a surgical mask, you wear the N95, you have to realize that the outside of this mask is now contaminated. you need to be able to take it off in a way that does not get you contaminated. So when you wear the N95 mask or the surgical mask, which I don't have with me today because I left them at the hospital, when you take these off, it's called doffing. When you do this, you basically need to lean forward and undo them from the front and set them down this way, so the front part that is contaminated is not touching any surface that you would be then touching. Again, now if you want to reuse that, you need to either know that your outside is contaminated when you put it on your face, or you use gloves and then take them off. But again, don't touch the outside and then touch your face or touch your skin or anything like that. Also, if you have multiple masks, take one off and leave it for a while. That is what healthcare workers are doing that don't have the proper volume of PPE, and they let it wait for 3 days, and hopefully that the virus dissipates and does not live any longer on that surface. Now, there are higher numbers, higher letters for masks that can be used. These typically are not disposable masks, and they're used for different industries. They can be used. We even use them as backup masks in the emergency department. But again, if we deplete the supply of these and we run out of N95 masks, we do not have any options. We want to use the appropriate equipment. So please, everybody out there, use the appropriate mask for the setting that you're in. Community setting in general can use a cloth or a surgical mask. In the healthcare setting, anything greater than an N95 mask. Now, let's talk about gloves really quickly. Gloves are meant to be disposable. You do one thing, you're finished with it, you throw them off and throw them away, wash your hands. They are not meant to be used at a grocery store, to be picking up things, putting them in your bag, touching your cell phone, touching your face, touching your hair, retouching things all over the place. They're dirty, contaminated surfaces. So please do not use gloves inappropriately in that setting. Gloves, when used in that way, are cross-contaminating, spreading a virus everywhere. Even though in your heart you believe you're doing the right thing and trying to protect yourself, you're actually making things worse because you'd be more aware of what you're touching if you weren't wearing gloves. So please, if you're going to wear gloves, use them appropriately, using them for one-time uses. Don't reuse them. And if you have to reuse them, you need to wash them just like you would be washing your own hands with 20 to 30 seconds of hot, soapy water. All right, that's been your breakdown of the multiple different types of masks that are out there and what to do with the gloves during this current pandemic. If you have any questions, please leave me a comment below, or if you have any other topics that you want me to talk about, I will surely get to it. Now, please hit the subscribe button and turn your bell notifications on, and also hit the like button if you want me to do more videos just like this one. Thank you so much for watching, and stay healthy, my friends.